My name's Helen Bevan and I work for NHS Improving Quality, the national improvement body for the National Health Service in England, and I'll be working with you on the 8th of December throughout the day. So what I wanted to do in this film now is to just give you some ideas around the kind of themes and perspectives and approaches that we'll be using on the day. Now, for this mini course, we're using a flipped classroom approach. And what that means is that all of us will do some work beforehand, and it means that on the day we can really focus on learning together as a community, collaborating in an interactive way and really getting the most learning from the day. So our theme is that when we're thinking about the radically different future that we want to design for our patients, for our communities, for our colleagues, we can't drive into the future using only our rear view mirror. You know, in a sense, we can't just do more of or less of what we've done in the past. We have to face a brave new world. And as we said, you know, what we're going to do is we're going to build a community. We're going to spend an inspiring day with individuals who are like-minded. And what we're going to be doing is looking at the implications and opportunities for transforming our world of healthcare in a world where change is becoming more rapid and disruptive, and many of the existing levers and mechanisms for change are diminishing, particularly the power of hierarchy. So we're going to spend a day in the future thinking about what it means for each of us and the work we do and the people that we serve in this brave new world. So, what are the objectives of our day together? What we're going to do is we're going to look at major themes and trends from around the world when it comes to change, transformation and disruptive innovation. You know, it's very interesting. When you look globally across multiple industries and sectors, across many healthcare systems, actually the direction that people are pointing to, the practitioners, the researchers, the futurists, it tells a similar story. So what we want to do is to take those future directions, those ideas and those principles, and think about what it means for us in our own practice, in our own context, as leaders of change and improvement. And what we also want to do, we want to have a very special day together on the 8th of December, where we're actually going to model these new ways of collaborating and learning collectively as a learning community in the mini course. So this film is one of 3 pieces of pre-work for our mini course, if you like, our flipped classroom approach. So I hope that all of you are able to watch all this film. Connected to this film is a white paper of which I was a co-author, which is called A New Era of Thinking and Practice in Change and Transformation, a call to action for leaders of health and care. And the ideas I'm going to cover now in this film are based on the content of that white paper, but I hope it'll bring it to life a little bit. In that white paper, it's an e-document, so there are a series of embedded films. And again, I would really encourage you to watch those films. And then the final piece of pre-work is that we're going to ask you to complete what we're calling a transformational profile. And this talks about you, who you are, you know, what your aspirations are in terms of your own transformational challenges and what you want to get from the day. And we hope that everybody will be able to fill those in and send them back by the 3rd of December. So, this is the white paper that we've asked you to look at. And again, you know, 95% of the content of this paper, or the ideas in this paper, are from sectors outside of health and care. And it's really interesting because, you know, whatever sector we look at, whatever industry, people are talking about the trends in the same way. So, you know, I'm pretty confident that we as a healthcare industry, you know, leaders of healthcare improvement, we need to be sitting up and we need to be learning about and thinking about those trends if as the white paper says, we want to join this new breed of leaders of health and care globally who are rewriting the rules of change and leading change in the future for different results. So that's very much the idea of our day together. So this picture is a personal one. It comes from the installation artist Adam Katz. And what he did, he took, I think, 10,000 orange plastic soldiers and he stuck them on an office window to make this sentence: all of my good ideas are battles. And I think that all of us that have worked in healthcare improvement for some time, our lives feel like this. You know, because we are the people who are challenging the status quo, who are saying there could be a better way. And very often that feels like a battle. I really like also this quote here that comes from Thomas Huxley, the evolutionary biologist. And here he was defending Darwin's theory of selection. And he said, new truths begin as heresies. I believe that. You know, I believe every new truth begins as a heresy. And I think that there are lots of new truths in healthcare improvement. And I think that we, you know, as the leaders of change, are often the people that are putting across the heretical ideas, and we know what happens to heretics. I want to show you another heretical statement. This comes from Gary Hamel, who, according to the Financial Times, is the #1 business influencer in the world. And he says change always starts on the fringe, at the edge, and it always starts with the activists. And yet the truth that is consistently given to us is that change starts at the top. So what are the leading edge thinkers and the futurists, the key influencers like Gary Hamel, John Cotter saying? They're talking about the single biggest thing that is happening in the world right now that impacts on our ability to deliver change. And I'd say, you know, globally, there's a lot of consistency about what that big thing is. What they're talking about is a seismic shift in the way that change is happening across the globe. And I would say that it's a seismic shift that we haven't necessarily caught up with yet in healthcare, but it's coming. And I want to talk about 5 different angles to this. So the first is that change is happening more and more quickly and becoming increasingly disruptive. And whilst there will always be a place for small-scale incremental change, we've got to focus more on large-scale disruptive change if we want to stay ahead of the system. The second big focus is on digital connection. You know, all of us in the developed world can connect with virtually anybody in any place 24 hours a day at very little cost or effort. So this digital connection has opened up so many possibilities around learning and sharing and changing more quickly. The third thing that's happening is that increasingly work is becoming more complex. That's definitely happening in healthcare, but it's happening in most other industries as well. And you know, we only have to look at our patients. You know, those of us that work in hospitals, compared to even 4 or 5 years ago, our patients have got much higher expectations. That very often the people that are in our hospital beds have a much higher acuity of illness. We're also in a situation, for instance, those of us who work in primary care, you know, we're supporting and caring for patients who even 4 or 5 years ago would have been managed, or their illness would have been managed with the help of a specialist in the hospital sector, and that just isn't happening anymore. So as work is becoming more and more complex, there is a very significant implication. And that is that the power of hierarchical systems is diminishing. Because in the past, you know, people did specific jobs that were more repetitive, that were more standardized, and it was easy to contain that workforce in a hierarchical system. And it just doesn't work in the same way anymore. So those of us that are senior leaders of hierarchies, you know, we can pull the lever, but it just might not work. And finally, and this is going to be a big focus on our day together, on the 8th of December, change processes are moving more and more to the edge of organisations. You only have to look at big corporate organisations and what is happening with their research and development functions. Whereas R&D would previously be in the centre of the organisation, what's happening is it's purposely being moved to the periphery. And the reason why that's happening is because in this world where people can connect and learn from each other, if we want to stay ahead of the game with change, we need to have our change people, our innovators, really connected at the boundaries of our organisation, and to be spending as much or more time externally connecting with, learning from, sharing with other people as they are in the middle of the organisation. I really like this quote here from Maddie Grant. She says, "We are on a collision course between the new organic, human-focused forces of social media and the machine world of our organisations." And you know what I'd say about this? If we're not careful, there's a train crash coming. This cartoon is funny, but I think there is some real truth in it. What we have here is the organisational leader saying to his colleagues, instead of risking anything new, let's play it safe by continuing our slow decline into obsolescence. And I think that's going to be the case of many healthcare organisations, unless we can think differently and we can act differently moving forward. So for me, this is a table that I think sums up very well where we are at the moment. And what it does, it contrasts a dominant approach to change with this emerging direction. Now, what's very important about this is that it's not a from to. So it's not saying this was the dominant approach and it's going away and the emerging direction is going to, to overtake it, or at least not in my lifetime. I would say that the dominant approach is still very much alive and kicking. And what we have to do as change agents, change leaders, is to be able to live comfortably in this ziggy-zaggy place in the middle. So let's just look at some of the differences. In this dominant approach, power comes from hierarchy. So the people with power are the people with positions in organisations. Whereas in the emerging direction, power comes through connection. The people with the power are the people who are working with virtual communities, with networks, are able to influence through connection. Here we talk about the vision and mission of the organisation, which is really important that we have that very clear sense of who we are and where we're going and what we want to be. But in this evolving era, it isn't enough. We have to focus as well on shared purpose, because we can't transform within a single organisation anymore. We have to look much more broadly. We need to think about how are we going to connect for a different future with our patients, with families, with communities, with partner organisations. And we can't use hierarchy to get those people to take the actions we want. We've got to focus on creating shared purpose on a very big scale. On this side, we talk about making sense through rational argument. We talk about change that is data-driven. We talk about big data and learning from that. We look at rational planning processes. Whereas on this side, it's about making sense through emotional connection. It's about people getting engaged in the change because it connects with what's in their hearts and their values. When I went to improvement school, quite a long time ago, what I got taught was that if I wanted to influence a medical doctor to change, I would have to show them a graph. I was told that the most effective way to influence a medical doctor was through statistical argument, but it's just not true. Even a medical doctor is far more likely to engage in change because we connect emotionally than because we're able to show data. Of course, what we want is the best of both worlds. We want a situation where we've got some really clear, compelling data for change, and we're able to wrap a narrative, a story that calls to action around it. On this side, leadership are the people, the senior leaders in an organisation are the people that are driving innovation. It comes from the top. We need to take out a whole amount of money from our bottom line in looking forward to the future, and we're going to do that through an innovation programme. Whereas on this side, this creativity, this innovation is coming from the front line, it's coming from our relationship with our patients and communities, it's viral and it's grassroots. The methods that we use here for improvement are ones that we've been using for a long period of time, that are tried and tested. We know they work based on experience. And in this world, because we can just connect with anyone, anywhere, the approaches are much more open. Okay? They're about looking out, finding the people who aren't necessarily the experts, but people with different experiences that we can learn from, sharing ideas, comparing data, co-creating change. And finally, this side, essentially it's about transaction. When we think about performance agreements, we think about compliance mechanisms, we think about regulation, we're holding people to account on a transactional level. Whereas on this side, it's about relationships. People are engaging in change because they want to, not because they have to. It's a different premise. So we need to be able to work with both. Now, I get to work with leaders of healthcare organisations across the world. And what I see pretty consistently is leaders who, in ambition terms, want to create radical transformational change, disruptive innovation. But the way that we're going about it, where we're driving the change, is largely from this dominant approach. And my view on this would be, we have to work in this way, of course we do. But unless we can work with the right-hand side as well, unless we can, really engage and create shared purpose on a very big scale, unless we can engage people in the change because they want to, not because they have to, unless we can truly embrace these open approaches, we're not going to be able to achieve the goals that we're seeking. We need to do both. And again, this is going to be a very big theme of our time together on the 8th of December. And I think this is interesting in the context of quality improvement methods. This is an interesting quote from Chris Argyris, and he talks about the essential flaw of quality improvement methods. And he says, the essential flaw is that when they're implemented, they tend to reinforce the mechanistic and hierarchical models that are consistent with the mental maps of most managers. And again, going back here, that if you're a leader and the change levers that you tend to use are the change levers from this side, when it comes to implementing quality improvement tools, Lean, Six Sigma, actually, if we implement them with a left-handed perspective, I think we will only get so far. Those organisations that I see doing exceptionally well with improvement methodologies are those that also embrace this side as well and frame the methodology in the context of the shared purpose, the change that we're trying to make, work in very, very engaging ways. So at this point, I would like to introduce John Cotter. Now, if you look at the last 15 years, John Cotter's book, Leading Change, has been consistently the most well-utilised, most influential change management approach across the globe. I think anybody that goes to university and does a course in change management will use this framework from John Cotter. And basically, he talks about 8 steps to transformation. And he says that if as an organisational leader you follow these 8 steps, you will significantly improve your potential to deliver a transformational outcome. And I won't go through them all now, but number 1 is around establishing a sense of urgency so that people will take action now. Create a guiding coalition, number 2, so that we've got the right people overseeing the change. Develop a vision and strategy, number 3, and so on. We really know that the world of change is changing, because now John Cotter says that this framework isn't enough to deliver change in the world as it's evolving. And earlier this year, John Cotter published his new book called Accelerate. And essentially what he says is that we can't create big change essentially or solely through hierarchy. You know, we can't create a change within an organisation using the levers of the structure of the organisation. It just isn't enough anymore. He said we need to have hierarchy and we need to have network. And again, you know, the hierarchy and the way that most of our organisations work was designed in an era where people did work that was much less complex, that was much more routine, repetitive, standardised. And this was the kind of work that it was easy to kind of contain within a division. And you know, healthcare organisations around the world are based on this model. Okay, you know, and they're designed to separate us, not to unite us, and to get the work done. And you know, this word division, I mean, we use it constantly. The division of general practice, the division of specialist surgery. You know, we use these words. And what Cotter says is that we need to be working with the informal systems as well. We need to be finding the people who aren't necessarily the leaders with the positional power, the hierarchical power, but the people that are the informal influencers, the people that are at the heart of the network. Now, there are a lot of implications for this, you see. If we're going to work in this way, we need many change agents. It's no longer appropriate to have, you know, key people in positional roles leading the change, so the quality improvement facilitator, or the patient safety leader, or the director of organisational development. Those roles are important, but they're just not enough. We need to have, you know, everybody in the organisation, everybody who connects with and uses the organisation seen as a change agent with many, many acts of leadership of change. What he also says is that if we're going to undertake major change, we need to get at least 50% buy-in, okay? Because we are moving from an era where you had to do change, you know, and this is the contract, or this is what the regulator requires, or this is what we have to do to achieve our compliance goals. Okay, we have to be moving to a world where we want to do change. I'm engaging in this change because I want to. And that's why John Cotter sets this 50% rule. You know, how often do we, in our change initiatives, do we actually seek out 50% buy-in before we start? I think not very often. And yet, what John Cotter's saying is, we need to be turning our change practice on its head. And we need to be spending a really significant time before we actually start the change on engaging people in it. And he talks about the spirit of the volunteer. He says, you know, we should treat everybody involved in the change process as if they were a volunteer, as if they were choosing to be part of the change, not having to be part of the change. And it seems to me that's a really good mantra. This is another piece of research that has definitely influenced my thinking about being a transformational change agent. This comes from two Canadian researchers, Batalana and Casciaro, and it was published in the July and August 2013 edition of Harvard Business Review. They went into a very large organisational system and they followed 68 change programs around that big organisation, and they drew a whole series of conclusions about what it took to be a great change agent. The organisation, the system that they carried out their research in was the British National Health Service. And what they found, I think in particular, two things that are of interest to us. The first is that for me as a change agent, okay, it doesn't really matter where I am in the hierarchy. Actually, being an effective change agent is very little to do with positional power. Being an effective change agent is much more to do with the extent to which I'm at the centre of the network and can influence other people informally. Secondly, they said, if you want to create change on a small scale, work through a cohesive network. And what they mean by a cohesive network is in a network with people like me. So family physician to family physician, okay, nurse to nurse, receptionist to receptionist, you know, peer-to-peer influence and peer-to-peer change. However, if we want to create big change, the kind of transformational, disruptive innovation that we're talking about, then what we've got to be able to do is to create what they call bridge networks between groups that are currently disconnected. So instead of working peer-to-peer, or as well as working peer-to-peer, we've got to start connecting people up who aren't connected. And again, at our time together on the 8th of December, we're going to be doing quite a lot of thinking about being the kind of change agent that creates bridge networks. Interestingly, what I see very often is lots of healthcare organisations who have got aspirations to create big change. But the way they're going about it is through peer-to-peer spread and peer-to-peer influencing, actually through cohesive networks. And I think there is a disconnect between our ambitions for change and the way that we're going about change, but it doesn't have to be that way. In our mini course, we're going to be working with 5 enabling themes for radical transformational change, which are the 5 themes in the white paper. And we're going to be talking about how do we activate the disruptive innovators, the mavericks, the heretics, the rebels in our organisation, because these people have got a key role to play in more disruptive change. We're going to talk about how we lead transformation from the edge so that we're not contained by the kind of existing ideas and practices of our organisations, but we're connecting up with lots of new ideas and approaches. We're going to be talking about how we can work with conversations and stories in different ways. I'm going to come on to this one in this film as well a little bit about how we curate rather than create knowledge, because that's very much a role for the improvement leader of the future. And finally, on our mini course, we're going to look at tactics for building these bridges, as we just talked about, to connect the disconnected. So let's talk about disruptors. You see, when you look across the world at what leading edge practitioners and researchers and futurists are saying, there's a lot of consensus that disruption has to become the new normal. If we want change to happen at a more radical, transformational level, then we've got to find the people in our organisations or who can influence our organisations in disruptive, radical ways. I like this quote from Celine Schillinger. She says that these are the kind of change agents who will question existing ideas, will open up new fields for action. And these are the kind of people that are most likely to help our organisations thrive and survive and adapt as we move forward. And you know, it's great saying that. It's great saying, well, we need to activate these people. And I guess that many of you are these kind of people. And yet what happens in organisations to the heretics, the radicals, the mavericks, the rebels, okay? Do they have a nice life? Typically no. Typically, when we choose to be the people that put our heads above the parapet, that challenge the existing ways that things happen, we can pay a very big price for it. And you know, we shouldn't underestimate this. Recently, I've been looking at brain science, and what this is showing is that being ostracised, i.e. being socially isolated because you don't go along with everybody else, can be, you know, just how traumatic an experience it can be. And in fact, we can experience it in our brains as deeply as physical pain. You know, there are so many forces and factors that are pushing us to conform, you know, to behave like everybody else, to fit in. And yet, you know, we need the rebels in our organisations. And you know, what do we mean by a rebel, a radical, a heretic, a maverick? Typically, we're looking at people who are the champions of a change initiative, of a campaign, a cause, or a particular action. And the thing about these rebels is they don't wait for permission to lead or to innovate or to create a new strategy. So they're out there taking action, but the thing about rebels is that they're not like unguided Exocet missiles that are causing trouble all over the place. They're responsible, they're ethical. The reason they're doing what they're doing is because it's the right thing to do. And these rebels can be very, very powerful people in our organisations because they name things that other people don't see yet. You know, they point to new horizons, new possibilities. And I think that this is my favourite saying about rebels. Without rebels, the storyline never changes. Without rebels, we keep going on doing the same thing. So this is great, but again, when we look across organisations, we see this thing that I'm calling here the 90-30 conundrum. And again, this is expressed in different ways in different parts of the evidence base, but it's pretty consistent. In this survey here, 90% of senior leaders are saying, yes, you know, we want to activate the disruptive innovators, the mavericks, the rebels, to play their role for change in our organisation. But only about 30% of those leaders are satisfied that those disruptive innovators, radicals and rebels are actually playing that role. So kind of intellectually, we understand as leaders the need for these people, but we haven't quite worked out how to do it. So, you know, what we need to be as transformational change agents and the kind of people that we need to be encouraging are what I'm calling here boat rockers. People who can rock the boat, can challenge the way that we do things, but not fall out of the boat. You know, people who are able to challenge the status quo because we see there could be a better way. When you look at the evidence base around effective rebels, what we see is that they are able to conform and rebel at the same time. And you know, I've always felt this really strongly in terms of my own role. So, you know, I understand that if I'm working in a team and our team has got kind of rebel tendencies and, you know, we really want to go for different kind of change, we understand that we have to be the most conformist people in the organisation. We have to be the team that gets its performance report in on time to a high standard every month. We have to be the team that always turn up for meetings and always turn up on time. We need to be the people that never speak badly of anyone else in the organisation. We know that we have to be the best corporate citizens in order to be the radical change people as well. Now, the thing that's really important about boat rockers is that they're capable of working with other people to create success, to do the things that are right. They are not disruptive troublemakers. When we look at the role of the future leader of healthcare improvement, one of the things that I see quite strongly is that we're going to shift our focus from creating change, from, you know, being the people that create lots of pilots and reinvent things and try them out, to being curators. Because in this new world of digital connection, you know, we can learn from so many other people and take account of other people's experience. So I think that over a period of time, this is going to shift. You know, when we use the word curate, that typically we mean it to, well, we think about it in the context of somebody who's a librarian or works in a museum, you know, creating taxonomies of things. But actually, you know, we're talking about curation in a very different way. You see, when you look at this digital world, the amount of data and information that is available to us is absolutely overwhelming. You know, getting information off the internet is like taking a drink from a fire hydrant. So you can just look one thing up, you know. You could look up improvements for frail older people. And on Google or any other search engine, there'd maybe be 9 million mentions. So, you know, what is good? What is valid from what is noise? How do we take that information and make sense of it for our own context? How do we share it with others and build on the knowledge? That, I think, is curation for a modern world. And this is a very big challenge for improvement leaders, you see, because if we think about knowledge, it's helpful to differentiate between tacit knowledge, which is like knowledge by learning. So we get tacit knowledge is kind of magic, because it's when we actually do things and change them at the front line that we gain the tacit knowledge. But if we want to spread knowledge on a big scale, we have to turn it into explicit knowledge and share it, and we're really bad often at doing that. Okay, so tacit knowledge is critical for large-scale change, the kind of learning that we get by doing things. But it's very, very difficult to turn it into explicit knowledge. But what do we know? What we know is that when it comes to sharing and learning from each other, and you know, particularly around tacit knowledge, the most effective way of doing that is through connection and conversation and social relationship. Here, you know, what's the best way to spread new knowledge? Okay, what it's showing us is that social connection and discussion and thinking about, who knows what and who learnt what and learning from other people's experience is 14 times more effective than written documents or best practice databases or toolkits. And yet, as a healthcare improvement industry, we spend our lives writing toolkits and identifying best practice and creating bundles. Okay, and yet, what research evidence will show us is that kind of toolkit, a way of sharing explicit knowledge, is probably one of the least effective ways of doing it. So we need to be thinking about, curating knowledge management for this new era. And this is the model that we're going to be using on the day, with regard to curating knowledge. It comes from Harold Jarkey from Ontario, and he talks about, as improvement leaders, we need to be seeking knowledge, okay, finding things out, keeping up to date, making sense of it, so taking that knowledge and giving it meaning for our own context. So in the white paper that is at the heart of this mini course, what we did, 95% of the evidence came from other sectors, but what we did is that we took it and we made sense of it for the healthcare sector. And then finally, we need to be sharing. Knowledge is an effective knowledge transfer is a social process. So we need to be connecting, we need to be collaborating, we need to be sharing in our own teams and working with our bigger networks. This is an example of curating for the new era. So my team in England, we've just produced something that we call The Edge, and it's a virtual knowledge hub for change activists in health and care to learn and connect and mobilise. And again, what we're doing is we're taking knowledge from all over the world around how to be an effective change agent, how to be a transformational leader, how to spread ideas about change, how to use the new methods for improvement in a social era. And we're creating a hub of people across the world that want to share and change these ideas. In our mini course, we have one big underpinning theme, which is this idea of calling it here thought diversity. And again, using a quote from Gary Hamel, tomorrow's management systems will need to value diversity and dissent and divergence as highly as conformance, consensus and cohesion. Unless we're bringing in these different voices, unless we're challenging the status quo, then change isn't going to happen. So just as we come to the end of this pre-work film, just one little message. As we move forward into the future, and we create our roadmap for transformational change, how we want that map to be, we need to make sure that we're part of the steamroller, that future direction, and not part of the road. And what I hope that our mini course on the 8th of December will do is to help us all to definitely be part of the steamroller and not to be part of the road.